But Mr. Hidayat, I think let's remember it's not just the tourism sector that's been hard hit by this crisis. Certainly, we have also feeling a lot of pain in the manufacturing sector, even in the agricultural sector, and certainly in every sector that you represent. So I wonder if you could speak a bit about some of the challenges that workers that you represent are feeling in the current context and what role your organization is playing. And it would be really helpful if you could also speak to how you envision the aftermath of this crisis.
Okay, thank you, Sarah. I really appreciate the opportunity. I think I'll try to address those questions just talking about three concepts. I want to talk a little bit about vulnerability. I want to talk about the value of work, and then something about COVID-19 as an occupational disease, and hopefully tie it all together a little bit. I think it's very important that in the outset there was reference to workers falling through the gaps. But I think that it's important when we look at vulnerability. One of the things the COVID-19 pandemic did was really expose the fragility of the global economic system and the vulnerability of large sections of workers and their communities. This wasn't created by the COVID-19 pandemic, it was exposed by, just like the failure of the public health system, underfunded and marketized and commercialized for 20 years has failed us. So I think it's very important to understand that vulnerability is constructed. And when we talk about workers falling through the gaps, we have to think about who created those gaps. And some of the biggest gaps that you fall through exist because of discrimination, of gender discrimination and racial and ethnic discrimination. That's the reality, and we see it very much today. And we need to tackle that. And I appreciate in this morning's session, in this forum, people talk about the global reset and changing the system. It's very important. But these are created gaps. So I think it's important that, you know, when we look at vulnerability and going forward in this crisis, all of the workers in our sectors are vulnerable in different ways. We work with farm and agricultural plantation workers who don't even have access to water and sanitation. We work in tea plantations in Assam, in India, for example. We work in banana plantations. And if you don't have access to water and sanitation, how can you carry out all the basic measures of protection of health and of personal hygiene, washing your hands and so on? It's a very basic issue and a very big issue for us. We also deal with issues in industries like seafood processing and meat processing, where you have you have very vulnerable groups of workers, women workers, but also a lot of migrant workers, in very crowded environments in seafood processing and meat, in cold temperatures with no ventilation. We have seen across the region and in other countries, particularly you see in the US, outbreaks of COVID-19 in this kind of population of workers. That is a vulnerability that existed before COVID-19, and we're now seeing the consequences of that. So I think it's important to consider that, again, when it comes to gender, race, and ethnicity, as we see today, this is critical to address that. You can't address all the issues that we've talked about of working together and collaborating to overcome COVID-19 together, us, if there's such a big gap between us and them. I think that how it relates to the value of work and what we're doing, it's really important that one of the things the COVID-19 pandemic showed us is that there are workers doing extremely important, essential work who have been undervalued for so long. Here we have the cleaners in hospitality, the housekeeping, the room attendants. You know, eventually when this tourism industry recovers, guests are looking for clean, safe rooms, personal hygiene. They need to be reassured. There needs to be trust. We believe that trust in safe hotels is built not just through a brand of saying the hotel's safe. And unfortunately, a lot of international hotel chains are just bringing out a brand of safe hotels. But if the housekeeping staff who are cleaning rooms, if the cleaners aren't well paid, protected, don't have personal protective equipment, if their work is not valued, then it can't be a safe hotel. We'll have that risk. There will always exist. So there's a strong link between vulnerable groups of workers and the value of work. In the lockdown, it is fast food workers, food delivery workers, food services workers feeding a population in lockdown. We have members in food processing feeding a population in lockdown. At some point, someone has to reconcile the fact they've been described as essential with the value of their work and what that work is worth. We can't continue to undervalue and underpay that work, which is on the front line of protecting customers in hotels, for example, consumers, but the public in terms of dealing with this pandemic. I think that that's a very big challenge, because This vulnerability was created around precarious employment, insecure jobs. And I think it's very important we tackle that. There are a lot of workers in key jobs like housekeeping, cleaning, who are in insecure jobs under outsourcing and casualization. Under those arrangements, employer responsibility doesn't exist. And the biggest challenge we're having is who takes responsibility for the health and safety of those workers, who takes responsibility for creating a safe workplace for them. They become a vulnerable group within our workplace if they don't have access to direct employment, but also if the employer responsibility continues to be hidden or denied as exists under precarious employment. So I just think that's a major challenge. And just final point, if you don't mind, is that I think it's very important. Most employers that we're dealing with, we're working together with some major companies. Yes, we're addressing issues, but most employers see COVID-19 as a public health issue that has encroached their workplace. We have to change that thinking and recognize COVID-19 is now an occupational disease. What does that mean? It means cooperation with unions in workplaces to deal with what is now an occupational disease in the long term. COVID-19 won't go away. We have to be better prepared for it. And safe workplaces that we create in this approach will save lives. Thank you.
Thank you, Mr. Hidiat. And that was very provocative, but I also think extremely important. And I hope that we can pick up on some of these points further down the line.